It usually begins between 6 in the evening and midnight. Across thousands of Indian households, a baby who has been resting throughout the day shifts abruptly into a state of inconsolable distress. The physical signs are alarming to witness. The infant will stiffen their entire body, pull their legs toward their abdomen, turn a deep shade of red, and let out a piercing, rhythmic scream. This crying resists feeding, rocking, or any standard soothing technique. The immediate reaction in a joint family is a frantic rush to address what appears to be severe abdominal pain. Relatives assume the baby is suffering from trapped gas. Out come the quick remedies, dosing the infant with gripe water or massaging a paste of hing, asafoetida, around the baby's navel to draw out the pain. But the crying persists. It echoes through the home for hours, pushing parents to their psychological limits. The interventions fail because the household is trying to solve the wrong problem. When the crying doesn't stop, the focus almost always shifts to the mother's diet. She is placed under severe, unscientific restrictions. The family may forbid her from eating dals, potatoes, cauliflower, or spices, reducing her postpartum meals to a restrictive regimen of lasun and lahiyam. This practice is driven by the assumption that whatever the mother eats goes straight into the baby. The cultural belief is that complex, gas-producing fibers from her food transfer directly into the baby's stomach to cause agony. The psychological weight of this claim is crushing. It forces a recovering mother to accept the blame for her newborn's pain. She sits there, listening to her child scream, believing her own breast milk is the source of the distress. Diagnosing this false crisis does nothing to stop the baby from crying. It only manages to damage the mother's nutritional recovery and emotionally exhaust her when she is already vulnerable. To understand why the diet restrictions fail, we have to look at how lactation works. Breast milk is synthesized from the mother's bloodstream, not the contents of her stomach. Notice how the complex vegetable fibers from lentils and cabbage stay trapped in her digestive tract. They do not enter her blood, which means they cannot enter her breast milk to cause gas in the baby. A rare exception exists for about 5% of infants who have a cow's milk protein allergy, where specific bovine proteins from dairy can cross into the milk. But this requires a doctor's diagnosis rather than preemptive dietary starvation. The physical home remedies are equally ineffective. The sodium bicarbonate found in many modern gripe waters neutralizes the infant's natural stomach acid, which they need to digest milk and kill bacteria. And rubbing hing on the stomach does nothing internally, because the paste cannot cross the skin barrier to reach the intestines. Treating the baby's digestive system is an exercise in futility. Colic is rarely a stomach issue. The true source of the pain isn't located in the gut. The actual culprit behind these evening screaming spells is the infant's rapidly developing brain and immature nervous system. Think of a newborn's brain as a fast computer processor running without a cooling fan. When they wake up in the morning, the system is cool and functional, but as the hours pass, it becomes vulnerable. A baby spends all day processing new sights, sounds, and physical touches. Because they lack the biological ability to filter out this sensory input, their nervous system gradually absorbs it all until it overloads by the evening. This changes how we should view those physical symptoms. When the baby clenches their fists and pulls up their legs, they are exhibiting a total body neurological stress response rather than abdominal pain. The classic witching hour scream is an involuntary discharge of built-up neurological tension. The baby is simply overloaded by the environment and has lost the ability to tune out the world. Because this is a developmental phase and not a disease, pediatricians use the Wessel criteria to define it. A doctor will only diagnose true colic if the crying fits the rule of 3. The baby must cry for more than 3 hours a day for at least 3 days a week, and this pattern must persist for at least 3 consecutive weeks. It also follows a predictable lifespan. The neurological storm begins around week 3 of life, peaks in intensity around week 6, and then vanishes, often overnight, by month 3 or 4. Colic is a diagnosis of exclusion. We only use the term if the baby is otherwise healthy, eating well, and having normal bowel movements. If the baby is crying and failing to gain the standard 20 to 30 grams a day, or if there is a sudden change in the pitch or timing of the cry, those are red flags for hidden pain or hunger. You must also watch for physical red flags requiring immediate emergency medical intervention. These include projectile vomiting, bloody stools that resemble currant jelly, or any rectal temperature over 38.0 degrees Celsius. Colic never causes a fever. If those specific red flags are absent, the infant is physically safe. This shift in understanding clarifies exactly who requires the most support in the middle of an episode. Hearing your baby scream is exhausting. But clinical evidence shows this crying causes no physical harm or long-term damage to the infant. The actual life-threatening danger during colic is the psychological breaking point of the adult caregiver who has been enduring hours of piercing noise. Incessant crying triggers a fight-or-flight response in adults. Heart rates spike and impulse control degrades. This extreme frustration is the primary trigger for shaken baby syndrome, a catastrophic brain injury caused when a caregiver shakes an infant to make them stop crying. In these moments, the safety of the household depends on the psychological stability of the overwhelmed parent. If you ever feel a surge of anger or the urge to shake your infant, you must follow the non-negotiable put down and walk away protocol. Step 1. Place the baby safely on their back in an empty crib. Step 2. Physically leave the room and close the door. Step 3. Set a 10-minute timer. Use those minutes to breathe, drink water, and lower your heart rate. If you live in a joint family, this is the time to hand the baby to a relative who has not been listening to the crying. A baby crying in a safe crib for 10 minutes will not be harmed, but a caregiver who loses control, even for a second, will cause permanent damage. Colic is not a reflection of bad parenting. It is a temporary neurological storm with a definite end date. Your goal is not to fix the baby, but to save